Hello, I'm Dr. Dennis McKenna, and I'm so pleased today to be joined by Lester Clarke. Lester, great to have you here at Inside Albany Med.
It's nice to be here speaking with you.
Lester, you are a support team associate for environmental services, and I think when people see this video, they're going to say, that's a familiar face.
Yes.
I've seen Lester in the hospital and various parts of our campus for many years, and it's certainly something I'm looking forward to talking to you about your role here at Albany Med. So let's go back to the beginning. How long have you been here at Albany Med?
I've been here since March 11, 1991.
March 11, 1991. So we're talking about almost 35 years, 35 years here at Albany Med.
Yes.
That's wonderful. What brought you here to Albany Med?
Well, I heard about Albany Med, so I've come and filled out an application, 411 Merrill Avenue, interview with Mr. Gary Emmert.
Oh, you at Gary Emmert? Oh, there's a name many people would remember.
Yeah, he had me, I come here and met a lot of nice people. So I just fall in love working with Albany Med.
And you stayed here for your full career.
Yeah, yes.
That's wonderful. Support team associate in environmental services. Talk a little bit about what your day looks like and the work that you do.
Yeah, when I come in in the morning time, I monitor the patient care area, walk around, see what to be done. Empty rooms, I went up to the nurse manager's office and said, can I do this room? And if she said, yes, let's go ahead and prepare my equipment, come there and start it.
There are obviously a lot of rooms in the hospital. We have over 700 beds in the hospital. Is there one particular area that you work in, or do you work in all the different clinical locations?
All the clinical area of everything.
Yeah. And I know that obviously one of the things that we know is that there are many people who need to come into Albany Med, and there are people who leave all times of the day, and then there's always somebody who needs to get into that room, but we can't get them in the room until those rooms are cleaned and turned over.
Yeah.
So it's an incredibly important part of what we call our patient flow to make sure that those rooms are turned over quickly. Have you ever thought about or appreciated the fact that you and your team are such an important part of our ability to deliver care to our patients and to the community?
Yes.
Yeah.
Well, like when I go on the floor and I get a patient room and they say I have a patient coming at such a time.
Right.
I say I get in and I get the room done as fast as I can.
So when you show up on the floor, they're happy to see you.
Yeah,
They're like,
yes.
Lester's here.
Yes.
We're going to get this room ready for the patient who's either in the emergency department, or maybe they're at another hospital.
Yeah.
Maybe they're coming from the operating room, and we've got to get that room ready so they can get the care they need. They can't get that care unless you or your team are ready to do that.
Yes. And I'd get in and get it done. The patient would come right in.
Very good. And I know a lot of times we see you working on the hallways and the floors as well, correct?
Yes. Yes, I work on hallways, patient rooms, offices.
Right.
I do it all.
I suspect, is there any part of the hospital that you haven't been in? You've probably been in all the parts of the hospital.
I've been in all the parts of the hospital and the college.
Do you ever step back and think about how much it's changed since 1991? We have new buildings, we have new operating rooms, we have new patient towers. It must have been quite a transformation to see over those last few decades.
Oh, yes. This place changed so much. When I started here in 1991, It was just not the D building. D building wasn't up.
Right.
Just the first floor. They start the foundation up to first, second floor.
Right.
And then I come in. Sometime I walk down the hall, I gotta look, where am I? Oh, I'm in the D building,
Do you ever see patients in the hallway who are lost? And
Yes.
I bet you can help them to get to where they need to go.
Yes, patient and visitors.
And do you help them to where they need to go?
Yes, I direct them, I take them to where they want to go.
It is one of the things that I know many of us like to do when you see a patient looking around. Of course, I think we've done a great job with signage and getting people where they need to go, but it's still a large place and people sometimes can be nervous. So someone like yourself who's been everywhere, you can get them anywhere they need to go.
Yes, I see visitors come in, they don't know where to go, they're looking around and say, can I help you, please? They say, yes, I want to go to D3 so-and-so. I said, come, I'll take you. And whatever I do, I stop, do it, and take them to where they want to go.
One thing that we've been talking a lot about lately, and we're going to talk even more about this year, is pride in our work space and making sure that not only do we provide excellent care but we do it in an environment that's clean and welcoming. And a lot of that is the work that you and your team do, right? Because when you come into a hospital, one of the things that you want is to know that it's an environment that is clean and safe. And I just want to say, I think that the work that you and your team do is so important to helping us with that patient or visitor or even workforce experience.
Yes, and that's the thing that I love to do. A clean environment. I'm looking forward for the visitors come in, they go into the waiting area. I like to see it clean. If I pass them by, I see anything, or to the place to stop and say, excuse me, I pick it up, throw it away, and make sure everything okay. If there's a spill, I take it up.
Treat where we work like it's our own workspace, like our home, pride in it. Are there people that you've worked with over these years? There may be some people you've worked with for 25 or 30 years that you see at work and say hello to you. Are there any people in particular that you go back with several years with?
Okay, go back several years. Just a few nurses.
Yes.
I go way back. Tom Bucci.
Tom Bucci? You worked with Tom for many years?
Yeah, Dan for many years. Mm-hmm. Even Nick, when Nick first started here, I worked with him. But I work with several nurses.
Yes.
Most of the nurse manager on the floor knows me.
They know you. Here comes
and
Lester.
Because here comes Lester. Can you do this for me, Lester? I say, sure.
Sure, I can.
Yeah, even with Tommy on C6.
Yes.
Yeah. Every time she see me, say, can you do this, Lester? I say, yes. And he'll be called like a patient room.
Yes.
He called like F building to forget his name.
I think
patient over the patient rooms and stuff like that.
I think it's very interesting that you mentioned C6 and Tammy Ferdemia, who's the nurse manager there.
Yeah.
Because I have often said when I walk on that floor, it looks so clean.
Oh, yes.
Everything is put away. Nothing's on the counter. Hallway, it looks like it's shining. So I must have known that it was you who helped make that happen.
Oh, yes. And she's a very nice lady.
Tell me what your style of leadership is when you have people who report to you and who you have to work with. What's your philosophy on working with other people?
Like for instance, I got a floor to do, and we got 2 or 3 of us. We get together and make a plan how we're going to do it, and everybody come together and do the job.
Very good. Yeah. Very good. Why do you stay at Albany Med? Why did you stay 30 plus years?
Because I love it here. I love the people, the patient, the visitors, the nurses, the doctors, managers like you, CEO like you.
Nice.
I love it here. I don't plan on going anywhere no time soon.
Well, that's good to hear.
Yeah.
That's good. One of the rules is if you do a video with me, then you have to stay. You can't leave. We talked a little bit before we went on camera that you are one of the members of our workforce that was not born here in the United States but came here. So where were you born?
I was born in Westmoreland, Jamaica.
Jamaica.
Yeah.
You may have read that one of the things that we talk about is our workforce is very diverse. We have people who work at Albany Med from over 80 different countries. Yeah. And that's something that we're very proud of because obviously we think that creates obviously a vibrant workforce with many different people. And so it's not surprising to hear that you came from Jamaica. Yeah. And do you ever go back home to Jamaica?
Yeah, I visit Jamaica at least 2-3 times a year.
Is that right?
Yes.
Okay.
Yes,
Weather's great down there, and
yeah, weather is nice, and plus there's my home. I'm building my home there and everything.
Home. Very nice. And we were talking a little bit also about what you like to do outside of work, and you like to garden. Is that right?
I garden. Yeah, I like to plant vegetables and stuff like that. Every year I do that.
And you grow your own vegetables to eat?
Yes, yes. I'll be planting callaloo, tomato, cabbage, lettuce, corn.
Yes.
Stuff like that. Colored greens.
Okay.
Peppers, hot peppers, and sweet pepper.
You have a green thumb.
Yeah, yes. I love to do that. I used to do that back home, me and my mama.
Get in the soil, get your hands dirty, see things grow.
Yes.
Very good. Well, I hope you have a good season this year growing.
Yeah, I hope so. Plus, when I go on vacation, I like to cook and feed the neighborhood.
Cook and feed the neighborhood.
Yes, in my district.
Okay.
You got the older people. I will 2 or 3. If I go for 3 weeks, 2 weekends out, the 3 weeks I cook, and everybody come over and eat.
You're supposed to be relaxing when you're on
yeah,
vacation.
relax. I like to do that. Cause my father used to do the same thing.
Your father did the same, and so
yes,
you do the same.
Yeah. Uh-huh.
So what would be a Lester special? What would you whip up in the kitchen?
Jerk chicken.
Jerk chicken?
Yeah, curry chicken, anything, oxtail, anything. I could do it. Do it all.
Okay.
Yeah.
Maybe one of these days I'll have to try some of that.
Okay, no problem. Just let me know. I let Mr. Bucci know I do it.
Okay.
Yeah.
Tom and I will come over. We'll have some as well. That's wonderful. I just want to thank you, Lester, for not only what you do here every day, but your infectious enthusiasm, your positive spirit. You and your team are a huge part of our mission here. And we talk about how what we do at Albany Med is so special and unique. But we can't do it without everybody, and you're certainly one of those very important people. And I'm glad to hear that you have no plans of moving or changing jobs, and you want to stay here with us, and that makes me very happy as well.
Yeah.
Any other final thoughts that you have? Anything?
Yeah, I just want to congratulate my team, my supervisor, my manager, my co-workers, and stuff like that. I've got a project team. We work together, 4 or 5 of us. They're very nice people. And we get together and we do some amazing work.
It's not surprising to me that you would take this opportunity to thank them and call out the members of your team, because that's the type of person you are.
Oh, yeah.
Well, thank you.
Thank you, Mr. McKenna.
We appreciate you being here. We appreciate everything you do. And I'm sure many people will love seeing this video, and they're going to see you in the hallway and say, oh, I saw your video, and learn a little bit about you. And be careful now, you might have to start bringing in more food. But
okay, no problem, no problem.
Very good.
No problem.
Well, it's good to meet you.
It's nice to meet you, Mr. McKenna.